Hello, I'm Professor David Halpin. I'm a chest physician in Exeter. I was asked by the college to organise this conference, which was quite a challenge, but also a huge opportunity. The programme is based around feedback from previous meetings, but also on my own views as to what general physicians ought to know about, and trying to focus on some areas where there's new treatments developing, other areas that are just very common conditions presenting on the acute medical take. So far I've been really pleased with the programme. I think all of the sessions have been excellent. They've provided really practical advice for frontline physicians about diagnosing and managing patients presenting on the acute take, and have been absolutely first-class presentations.
My name's Martin James. I'm a consultant hepatologist at Nottingham University Hospitals. I work there predominantly in HBB endoscopy and parenchymal liver disease. I've come to the college today for the RCP update in acute and general medicine, and have contributed with a talk on hepatology and acute liver problems. I think the conference itself provides a really vibrant atmosphere to learn perhaps areas that we haven't been keeping up to date with in our own subspecialties, and brings together a lot of colleagues from different areas of medicine to share and update each other on relevant areas. There are three main causes of chronic liver disease in the UK, and they're all on the rise. Alcohol, you'll be well aware of, there's a lot of publicity, a lot of political talking at least at the moment about alcohol. Non-alcoholic fatty liver disease, which is a broad church that covers people with NASH, non-alcoholic steatohepatitis, liver fibrosis and cirrhosis as a result of fatty liver, and also viral hepatitis.
Anne Ballinger, I'm a gastroenterology consultant and general physician at QEQM Hospital in Margate, which is part of East Kent Hospitals Trust. The conference today, well, so far very enjoyable. I particularly enjoyed the dermatology section, and perhaps rather surprisingly so, the talk on pressure ulcers, which I wouldn't necessarily choose to go to, but actually was very informative. I'll take a different approach to assessing patients now and assessing their risk, and I'll certainly go up and look at those scales to how to assess risk. So I do have experience of assessing the patients, when they very first present with acute abdominal pain, as other acute physicians or general physicians would, and then perhaps their later assessment when we're referred on. So I've got three questions to begin with. A 20-year-old female, previously healthy, so no medical, surgical or gynecological history, presents with 24 hours of urinary frequency and dysuria and right flank pain. Okay, so most of you opted for an ultrasound examination.
My name's Anita Donnelly. I'm the Clinical Vice President of the Royal College of Physicians, and I'm an acute physician in Plymouth. It gives me enormous pleasure to say a few words about the Acute and General Medicine Conference, an annual event for the college, which is an unrivalled opportunity to learn about recent advances in the subject, and also to meet and network with colleagues who share the same areas of clinical practice. You'll learn about recent updates and new research around this area. I spoke this year about the Future Hospital programme. So the reports that the college produced from about 2012 onwards relating to the workforce and relating to the context of clinical physicianly practice identified that we were in the area of a perfect storm, with rising clinical demand, changing needs of the patient population, fragmentation of care, out-of-hours care breakdown, and a crisis in the medical workforce that continues today. The principles espoused by the Future Hospital Commission in the report included that patient experience and outcome were considered to be the main focus of what the future care should look like.